I am Dr. Ram Narayan, Senior Consultant Restorative Neurosurgeon. What is this restorative neurosurgery? This is a new branch of neurosurgery which involves surgical management of lost nervous functions. Nervous functions get lost due to various conditions like Parkinson's disease, like stroke, paralysis, so many conditions. So nowadays, by surgical methods, we can restore this lost nervous functions. As we all know, conditions like stroke, conditions like incontinence, conditions like even addiction, all these have a lot of not only medical problems but also a lot of social connotations. A lot of lives get lost because of this, a lot of financial problems happen. So by surgery, especially in those resistant cases where no other treatment is possible, by surgical methods we can help these patients get back to a normal life. Today I'll be talking to you about a problem called cerebral palsy. As the name implies, cerebral palsy means there is some damage to the brain. I will explain when this damage occurs. So I'm sure when all of us were born, our grandmothers and our elderly people in the family, the first question they would have asked is, did the baby cry well? I'm sure all of us would have wondered why they are asking this question, why should the baby cry? The baby actually does not cry, but suddenly the baby who was under the protection of the mother for many months suddenly comes out in the open world without any protection, and obviously it has to breathe to survive. So what it does is it takes breath like this, which we feel as a cry, and this is very important. In fact, there's something called Apgar score and all that, which is scored and which is very, very, very important for the baby's future. Suppose the baby doesn't cry in time, what happens is the baby does not get the oxygen that is required for a normal life. The brain is very susceptible to loss of oxygen, and the brain can get damaged even if there is a loss of oxygen for a few minutes. This will cause damage to the brain structure and functions, and this will end up in cerebral palsy. So what does cerebral palsy do? One common problem with cerebral palsy is that the children become very stiff and they have difficulty in walking and all that. There's actually what we call scissoring of it. When they are walking, their legs go like this, so that they can't walk and they tend to fall down. It's scissoring. Then there is another type of cerebral palsy called dystonic cerebral palsy. They keep on moving like this. There will be frequent movements. There are other types of lesser types of cerebral palsy, but these are not very common. The commonest is 95 to 98% is either spastic or dystonic cerebral palsy.